My name is Dr. Felicia Valianatos, and I'm a dentist working in Melbourne, Victoria. I have traveled through professional environments from far away in Europe to here in Australia. I graduated in 1995 in Bucharest, and then I just arrived here. I finished there some postgraduate qualifications to advance my skills in general dentistry, and I worked in public and private hospitals back home. I've done a residency program, which was a 2-year program back home in Bucharest. Then I worked there in public and private practice just for 3 years. I started early in my career, and then I came to Australia. So it took me from start to end from 1998 to 2000, so long time ago, and yeah, it took me 2 years to go through the process at the time. I couldn't imagine myself doing anything else but being a dental practitioner, so I was ready to take any process that would get me across the line, so the ADC process was it. It took me through initially working in Melbourne, obviously, as a dentist. Really enjoyed my experience in the public system there at the hospital under mentoring, coaching of experienced practitioners and specialists. I really enjoyed working in the theatre in that environment and emergency department, where I became quite familiar and comfortable working with trauma and acute presentations. So then I tried private practice, but it wasn't really my preference. So I went back to community health, joined a community health organization, and I've been there for 17 years. So that was my professional sort of travel. But during this travel, I really had growth opportunities, and I had an opportunity to be a clinical leader in a team of dentists. And then I could grow professionally into managerial roles. So I have just finished a Master's of Health Management with the University of New England. So this is where I am today in the role as a general manager of the community health organization. For me, really, if I want to achieve something, and if I see a purpose in anything, then I will find the drivers and I'll make it happen. So how you find the drivers, I think it depends on the challenge. Everything starts with a challenge. I like to see the end result of what I want to do before I even started, and then everything happens along the way. So I think the drivers are secondary to the purpose. Obviously, being a candidate, I feel like I brought some insights that are quite unique to the candidate's world into the ADC, and over many, many years I saw a lot of these ideas put in practice and other candidates benefiting from them. I think I have other experiences that are contributing to my role as an examiner, particularly my fellowship with the Royal Australasian College of Dental Surgeons, and that really created a framework of excellence that I've been following, and I hope I brought it into the examination process and content. Because I work for community health and I'm also a fellow of the International College of Dentists, I think I have a good insight on vulnerable population groups, and I'm very proud to see ADC taking actually leadership in having these simulated exercises very much patient-centered, which is very pleasing to see. Also, I work with the dental board as a performance assessor, and that work in observing the deviations from the standards of practice was very useful in myself making judgments as an examiner. I think any advice has to be received with an open mind, because it's really a personal experience, and I'm mindful as a candidate, you look at this advice and you tend to take it very, personally, and it's really my opinion. But I think when I look back at my experience as a candidate, the first thing that springs into my mind is really hard work. Reviewing the dental literature, and particularly the literature that's relevant, current to this environment, the Australian environment. Secondly, I think it's very important to study with purpose for the examination content. For example, in my case, I had to go to Viva examinations, and at that time English was a new language for me, so I remember that I spent a lot of time speaking out loudly, recording myself and listening to myself to close that gap. And finally, and probably most importantly, is I think it's important to have a stress management plan. It's a high-stake exam. For me, it was very difficult at the time because I only gave myself one chance. It was very important for me to pass on the first attempt, and having a stress management plan and a way of understanding my emotions and managing those emotions during that critical day or week. At that time, I had a week examination, was quite important for me to give myself the best chance.